Hi, this is Andrea Kane, and I am here with HSC 114. We are working on medical terminology using the Language of Medicine 12th edition by Davie Ellen Chabner. And you are now starting week 3 in our syllabus, and we are starting our first body system, which is the digestive system. So we will be getting into a lot more anatomy and physiology as we go through here to match up our terms. Chapters 5 and 6 both focus on the digestive system. I'm going to go through chapter 5 now, and I'll do a separate video on chapter 6. Our chapter goals are to look at the organs and describe their locations and functions, really study the combining forms for this section and the meaning of the related terminology, look at signs, symptoms, and disease conditions that affect the digestive system. And we will start by talking about just the digestive or gastrointestinal system as a whole. Your GI tract or your digestive system performs 4 main functions: ingestion, digestion, absorption, and elimination. Those are the 4 main functions of your digestive system. Ingestion is the food material is taken into the mouth. Digestion is where it's broken down mechanically and chemically as it travels through your GI tract. So in your mouth, you break it down mechanically using your teeth, but also chemically using your saliva. And then it's going to travel as a bolus down through your esophagus to your stomach. And even more digestive enzymes and acids are going to break it down. When it breaks it down, your proteins become amino acids, your sugars become glucose, and your fats turn into fatty acids or triglycerides. Then your digested food, this is absorption, which is the next stage. It passes into the bloodstream through the lining cells of the small intestine. You need to know this. Small intestine are where that absorption happens, and it moves it from the intestine to the bloodstream through those lining cells. Those nutrients then travel to all cells of the body through the bloodstream. The cells burn the nutrients to release the energy stored in food. Elimination is what happens after the small intestine. There are solid waste materials that cannot be absorbed into the bloodstream in the small intestine, and they continue on through the large intestine. And through the large intestine, it's going to concentrate these solid waste materials into what are called feces. And this feces, which is waste, passes out of your body through your anus. So let's talk about the organs in the digestive system, how they work together. It begins with the oral cavity. The parts of the oral cavity are the cheeks, lips, hard palate, soft palate, rouge, uvula, tongue, papillae, tonsils, gums, teeth, pharynx. And here's a visual for us of all of those pieces and parts. You can see those are numbered on the right-hand side of your screen. And then you can see the combining forms on the left-hand side for all of those parts. So for instance, cheek is bucco. Lip, which is number 2, is chilo or labio. 3 is your hard palate, palato. 4 is your soft palate, which is also palato. 5 is your uvula, which is uvulo, and so on. So this might be a helpful visual if you're having a difficult time figuring out the combining forms and what parts they go to. This gives us also the anatomical terms of a tooth: crown, root, enamel, dentin, pulp, gingiva, cementum, root canal. Hopefully you won't ever have to have one of those. Periodontal membrane. And this is a visual for the anatomy of a tooth, the different pieces and parts, and how you can see the blood vessels and nerves in there. Deglutition. Deglutition means swallowing. It's a fancy term for swallowing. Deglutition. Make sure you know that one. Hint, hint. Anyway, this shows you how it starts. If you look on your screen here, I'm trying to circle it with my mouse. You can see the green is the food bolus. And this person has just finished chewing it and is getting ready to swallow it. And the reason they show you this is because they want to show you what it looks like when your epiglottis is closed. When your epiglottis is closed, it means you're not taking a breath because you don't want to eat and swallow at the same time. Has anyone ever choked and done that? I have. It is very unpleasant, and then you cough and cough and cough to get that liquid or those particles out of your lungs. That's what causes aspiration. If you've ever heard of aspiration pneumonia, somehow some fluid or some particles have ended up in the lungs because the epiglottis wasn't closed when somebody was swallowing. When the epiglottis is open here on the other side, you can see the food bolus has passed, and now it's open for the trachea to have air go in and out. And that's what this just shows. So parts of the stomach. The esophagus then leads to the stomach. The stomach includes the lower esophageal sphincter. That's a lovely one to say. Lower esophageal sphincter. Fundus, greater curvature, lesser curvature, Rouget, body, antrum, pylorus, and pyloric sphincter. And this is what those pieces and parts look like in this visual. So you can just take a look and see. You can see at the top the esophagus, and you can see as it's leaving, it's starting to head into the small intestine. Now we get to the digestive tract. This is really, you can see it starts with the esophagus and stomach, but it's really going through the small and large intestines and the pieces and parts that come into play. So you've got esophagus, stomach, duodenum, liver, gallbladder, pancreas, jejunum, ileum, cecum, appendix, ascending colon, transverse colon, descending colon, sigmoid colon, rectum, and anus. And here's a visual of all those pieces and parts intertwined. Okay. In that small intestine, there are something called villi, and they are there in that lining. And this is a great visual to show you, if you take a cross section, where the lymph and blood vessels come into play. And that's where you have that exchange of the nutrients being pulled out and put into the bloodstream so that the waste material can go on to be processed in the large intestine. Parts of the large intestine are the cecum, appendix, ascending colon, transverse colon, descending colon, sigmoid colon, rectum, and anus. When I learned about the different parts of the large intestine, one of the ways that I memorized those is I did a visual. I did ascending, transverse, descending, and then it got a little crazy with that sigmoid colon. So when you're trying to memorize some of these things, try and think about the shape. If you're going to draw a box, ascending, transverse, descending, and then the squiggle that is the sigmoid. Hopefully that will help. Parts of the liver, gallbladder, and pancreas. Excuse me, I guess I need to stop for a sip of something here, hopefully tea. Liver, gallbladder, common bile duct, pancreas, pancreatic duct, and duodenum. All right, so parts of the liver, gallbladder, and pancreas. This is what they look like and how they're intertwined. You can see that the stomach kind of curves around and holds the pancreas gently. The spleen is on the top right side of the stomach, and the liver is above all that, and between the liver and the small intestine are the cystic duct and the gallbladder. Okay. Besides producing bile, what does the liver do? Well, it helps you maintain normal blood glucose levels. It manufactures blood proteins necessary for clotting It releases bilirubin, a pigment in the bile, and removes toxins and poisons from the blood. You can see why if someone has a diagnosis of liver cancer or liver cirrhosis, why it's so serious. Your liver does an enormous amount for your body, and so when it is diseased or when it has a tumor or becomes cancerous, it's very significant and it has a huge impact on the body. So, quick quiz. What happens if the bilirubin cannot leave the body and remains in the bloodstream? Well, let's think about this here. If you have bilirubin and it can't leave the body, it remains in the bloodstream, it's going to build up. It's going to get higher and higher and higher, and you're going to have too much of it. Which of these terms means too much bilirubin? I think that will help. All right, next one, pancreas and its functions. The pancreas does two things. It has an endocrine function and an exocrine function. The endocrine function is it releases insulin via the bloodstream to cells. So your pancreas releases insulin to cells through the bloodstream. The exocrine function that it does is it releases enzymes to the duodenum for digestion. So it's releasing these enzymes to the duodenum so that the digestion can occur. That's why your pancreas is so important as well. And people with pancreatic cancer do not last long. Food enters through your oral cavity, exits through the anus. And this is a great visual. If you're someone who likes to see sort of in a formula type way or a flow process chart, this is great in terms of helpfulness. And you can see how the pancreas is releasing enzymes and the liver gives bile to the gallbladder, who then releases more bile into the duodenum during that small intestine process of pulling out nutrients. All right. Next one, which term is the first part of the large intestine? First part of the large intestine. I will give you a quick hint by moving back to this page. Do you see where it says large intestine? What's the first part? And there you have it. All right, which term means swallowing? I pronounced this for you several times, swallowing. So hopefully you remember. So we have some terms here, and they are in your book. Just encourage you to make sure that you know what they are. And some more. All these are pretty common. Defecation is the process of eliminating feces from the digestive tract. Emulsification is that process of breaking up the large fat globules into smaller globules. That happens within the body. Whoops, went too fast. Sorry about that. Hydrochloric acid is a substance produced in the stomach necessary for the digestion of food. If you've ever had acid backup, sort of like heartburn, it's that hydrochloric acid, which is very, very acidic. And that's what's causing that process to go on. And some more vocabulary. And this just gives you, again, details about it. Did you know your liver weighs about 2.5 to 3 pounds? It's amazing. Mastication means chewing, or deglutition means swallowing. Mastication means chewing. And notice the difference between papillae and papilla for singular versus plural. Singular, papilla. Plural is papillae. Parotid gland. That is a salivary gland within your cheek that is just in front of your ear. Remember, anterior, in front of. Peristalsis. Peristalsis is the rhythmic contractions of tubular organs. So as a food bolus is going down through the esophagus, peristalsis is happening. It's that rhythmic contraction forcing that food down your esophagus into your stomach. And this is all just pretty much what we've seen before. Some more terms. Triglycerides are fat molecules composed of 3 parts fatty acids and 1 part glycerol, and they are a subgroup of lipids. If you've ever heard of somebody saying, oh, my triglycerides are too high, this is what they're measuring. Notice villi versus villus, villi versus villus. Singular is villus, plural villi. Now we get to our combining forms. Ano, appendo, appendiso, buco, cico, cilio, kilo, cholecysto, choledoco. Ooh, watch out for that one. Cholecysto is gallbladder, but choledoco is your common bile duct. Difference. Colo, colano, denti, duodeno, enteroesophago, fascio, or facio, depending on how you're going to be pronouncing that. Look at the context. Gastro, gingivo, glosso, hepato, ilio, jejuno, labio, lapro, linguo, mandibulo, odonto, oro, palato, pancreato, peritoneo, pharyngo, procto, pyloro, recto, cialadino, sigmoido, stomato, and uvulo. Lots of new combining forms there. And here are more. Amylo, Billy. And again, notice our combining forms are usually an O. But here we have Billy with an I and Coley, which has an E. Very unusual. So make sure you make note of those. And Billy is different than bilirubino. One is bile, the other one is biopigment. Cholechlorohydro. And that's CHL. Watch out for that. Gluco and glyco both mean sugar, but they're spelled a bit differently. Glycogeno, lipo, litho, proteo, pio, cialo, steato. Now we have some suffixes. Ase, chesia, iasis, prandial. Anastomoses. Your book goes into this a little bit. It talks about the different types of anastomoses. Sometimes, for whatever reason, and there are a lot of reasons, an anastomosis needs to be done. Most often, anastomoses are performed on the intestines, where a section of intestine has to be taken out, and then they have to be rejoined. There are times when it is end to end. There are times when it is side to side, and there are times when it is end to side, and those are the 3 types. Quick quiz, which term means inflammation of the lip? Way back, week 1, chapter 1, we learned that inflammation is itis. That should help you. Now you need to think about what is lip. What is the combining form for lip? I'll let you figure that out. All right, pathology of the digestive system, sorry. What can go wrong? That's what pathology is. What's going on that's not ideal in the digestive system? Some signs and symptoms. Anorexia means loss or lack of appetite. Ascites is an abnormal accumulation of fluid in the abdomen. Ascites is a big sign of cancer going on. A lot of times someone will come in with a very swollen belly and they will complain of other symptoms. They will take they will do a synthesis, an and they'll remove that fluid and test it and find out that there's cancer cells in there. But ascites is not a normal sign of a healthy abdomen. There's something going on there that should not be. You do have some fluid in there, but you don't have an enormous amount or not a lot. All right, borborygmi. Those are, or borborygmus. That's the burbling, gurgling, rumbling sounds produced by your GI tract because of gas or fluid going back and forth. Constipation is difficulty passing stools. Diarrhea is frequent passage of loose, watery stools. Dysphagia, difficulty swallowing. Eruptation is when gas is expelled from the stomach through the mouth, also known as burping. Flatus is gas expelled through the anus. Hematochezia is passage of fresh, bright red blood from the rectum. Again, if someone has hematochezia, that's serious. There's something going on there that should not be. It could just be some bloody hemorrhoids, bleeding hemorrhoids, but it could also be something far more serious like colon cancer. Jaundice or icterus is the yellow-orange coloration of the skin and whites of the eyes caused by high levels of bilirubin in the blood. Jaundice is a sign that there's something going on with the liver that is not normal. You often hear about newborn babies with jaundice where their liver hasn't quite kicked in yet in terms of all that it needs to do to move that bilirubin through, and so it builds up. Jaundice is oftentimes heard of with liver issues, that somebody has severe liver damage or they have advanced liver cancer. Melena, black tarry stools or feces that contain digested blood. Again, melena is another one, just like hematochezia, that if you see it in a clinical setting, it should immediately have red flags all over it that there's something really wrong. Nausea, I think everybody knows what nausea is as well as vomiting. And steatorrhea is when there's fat in the feces. It's frothy, foul-smelling fecal matter. Steatorrhea. Some conditions, pathologic conditions involving the oral cavity and teeth. Aphthous stomatitis. Aphthous stomatitis. Inflammation of the mouth with small, painful ulcers. Dental caries, tooth decay. Herpetic stomatitis. Herpetic stomatitis. This is an inflammation of the mouth caused by the herpes virus infection. Oral leukoplakia, white plaques or patches in the mouth. Periodontal disease, where you have inflammation and degeneration of the gums, teeth, and surrounding bone. So what are some other pathologic conditions in the upper GI tract? Achalasia, a failure of the lower esophageal sphincter muscle to relax. It stays constricted. It makes it very difficult to swallow food. And that causes the esophagus to dilate or expand because the food backs up in there. Not a good situation. Some other ones: esophageal cancer, gastric carcinoma, esophageal varices. You may hear about esophageal varices. These are most often seen on people who have who have taken in too much alcohol. They develop these varices, they can bleed, they get swollen, and they can open, and it causes a lot of issues. And so that's something also to be looking for, that if someone has bleeding or they're coughing up blood, they may have esophageal varices, and those need to be dealt with pretty swiftly. GERD, you may have heard of GERD, gastroesophageal reflux disease. Lots of people have this. They take something for it usually. It's where solids and fluids return to the mouth from the stomach. They back up for whatever reason. And there can be a number of reasons why GERD occurs. Peptic ulcer is an open sore lesion of the mucous membrane of the stomach or duodenum, and these are very painful. So if you hear of somebody who has peptic ulcer disease, they have these develop periodically, and they are miserable. I don't have them, but I've heard that. Hernia. We talked about hernias before. That's where there's a protrusion of an organ or part through the muscle that normally contains it. I mentioned before about inguinal hernias are common. Umbilical hernias happen. There are all of those. You can have a hiatal hernia, which is what they show here on the left-hand side of your screen, where it gets caught in the diaphragm and protrudes where it shouldn't. And those can be manually reduced. Sometimes somebody can shift around or press down or whatever and push it back to where it needs to go. If it can't be manually reduced, then it's probably going to need surgery to take care of it. And if it traps a part of your intestine, not only is it very painful, but it will require immediate surgery, because if you cut off the blood supply to an intestine, that can cause that part of the intestine to die. So it's really serious. Anal fistula, you've got something happening there. Colonic polyposis, or polyps. You've got colon polyps that are coming out of the mucous membrane of the colon and need to be removed. This is a picture of colorectal cancer, an adenocarcinoma of the colon or rectum or both. Crohn's disease. You may have heard about Crohn's disease. That's a chronic inflammation of the intestinal tract. And those who have Crohn's disease usually have a rough time of it. It is not something that's easy to handle, and it can be lifelong. So my heart goes out to all those that have Crohn's disease and are dealing with an exacerbation of that. Diverticulosis, that's abnormal side pockets or pooching ouches. Outpouching or outpouching in the intestinal wall. That's what that is, diverticulosis. You've got these little pouches that keep sticking out where they're not supposed to. Dysentery. You might have heard that long ago in the military they had issues with dysentery. That is typically because you've got some kind of bacteria or viral situation going on. Hemorrhoids. Those are where you have swollen, twisted, or varicose veins in the rectal region. And those are usually pretty benign, but if they get bad enough, they often need to be banded or have surgery for removal. Ileus is a failure of peristalsis where you end up with an obstruction of the intestine. So if you ever hear of a small bowel obstruction or a large bowel obstruction, typically it's more of a small bowel obstruction. This is also known as an ileus, that for whatever reason the small intestine is not moving the bolus or the materials through. They just kind of stop and sit there, and it causes this obstruction or partial obstruction. Inflammatory bowel disease is another awful situation where you have inflammation of the colon and small intestine, and people can have chronic inflammatory bowel disease. Crohn's disease is a type of that. Intussusception. This is where the intestines telescope, and I'm going to let you read through that in your book, or you can look that up to see what that looks like, but let's just say it's very unpleasant and can result in surgery. Irritable bowel syndrome, that's a group of gastrointestinal symptoms that are associated with stress and tension that upset the bowel. Ulcerative colitis, chronic inflammation of the colon, and there are ulcers from this inflammation. Volvulus, this is a twisting of the intestines on itself, and again, this can be life-threatening, especially in the elderly. Cirrhosis is a chronic degenerative disease of the liver. Cirrhosis is not only from alcohol. So lest there be a stigma about cirrhosis, let's be careful here, because cirrhosis can occur for a number of reasons, including in people who have never had any alcohol. So just be careful as you're doing cirrhosis that you don't have a stigma there. Hepatocellular carcinoma, HCC, that's also known as liver cancer. Pancreatic cancer, pancreatitis, where the pancreas gets inflamed or swollen, some kind of infection may be going on there. Viral hepatitis is an inflammation of the liver caused by a virus. Viruses are awful. They can get into organs and do an enormous amount of damage on a cellular level. So yes, you can actually have viral hepatitis. Cholelithiasis, that's gallstones in the gallbladder, fancy way. So that's what those look like. That's what gallstones can look like if you have a gallbladder removed and there's stones in there. All right, that is it for this chapter, and I will be back to talk to you about chapter 6 shortly.